There is a very common nighttime habit that can multiply the risk of tooth decay, and most people have absolutely no idea it's happening. Hi everybody, I'm Dr. Mehnaz, a dentist, and today I want to talk about the factors that silently put your teeth at serious risk at night when your body thinks it's resting, but your mouth actually enters its most dangerous state. The first one is mouth breathing, one of the most common things that happens during sleep, and many people don't even realize they do it. You might think breathing through your mouth isn't a big deal, but for your teeth, it's a slow, ongoing disaster. Saliva is your teeth's natural defense system. When your mouth stays open during sleep, saliva evaporates, the surface of your teeth dries out, acids aren't neutralized anymore, and the bacteria are free to do whatever they want. People who breathe through their mouth at night usually wake up with a very dry mouth, cracked lips, a white or yellow-coated tongue, and bad breath are very common signs. And that bad breath isn't just from foods, it's the result of bacterial activity in a dry environment. Over time, cavities become deeper and more severe. Many of these people think they just have bad genetics, when in reality, the main problem is nighttime mouth breathing. The second factor is stomach acid. The truth is that during sleep, acid can rise up without obvious symptoms. When you're lying down, acid can move toward mouth much more easily. That acid sticks directly to the teeth and starts dissolving the enamel. Enamel may be the hardest substance in the human body, but it's extremely vulnerable to acid. Repeated acid exposure makes teeth thinner, more yellow, and more sensitive. Some people notice sensitivity to cold water or even air. Others wake up with a sour or acidic taste in their mouth. All of these can be signs of repeated nighttime acid contact with teeth. One of the biggest mistakes people make is brushing their teeth immediately after waking up. Overnight, acid softens the enamel temporarily, and brushing at that moment is like rubbing sandpaper on your teeth. The best thing to do is rinse your mouth with water, wait at least 30 minutes, and then brush. That one small change can prevent serious long-term damage. The third factor is teeth grinding, another distracting nighttime habit that often linked to daily stress. Many people grind their teeth at night without realizing it. The pressure involved is several times stronger than normal trained pressure, and teeth are simply not designed for that kind of force. Repeating this pressure night after night causes tiny cracks, shortened teeth, and in some cases fractures. A lot of people wake up with morning headaches, jaw pain, and think the problem is somewhere else when the real cause is teeth grinding. And the treatment, a night guard, helps, but it's also very important to address the source of stress because nothing is worth risking your dental health. Another very common reason is drinking something before bed. Many people fall asleep after drinking sweet tea, soda, or juice. These sugary and acidic liquids stay on your teeth for hours, and because saliva flow is low at night, they create the perfect environment for cavities. The fifth factor is dry mouth caused by medication. Antihistamines, antidepressants, and sedatives all reduce saliva production. When this dryness happens at night, the risk of decay increases dramatically. And the sixth and final factor that many people don't even think about is not brushing before sleep because they didn't eat dinner. Some people say, I didn't eat anything, so I don't need to brush. But plaque forms on your teeth throughout the day, and nighttime is the most important time to remove it. If plaque isn't removed, it stays on your teeth and gums all night, and that leads to tooth decay. All of these factors together show one thing very clearly. Nighttime is a critical decision-making time for your long-term dental health. What you do before bed matters much more than you think. Maybe today it's just dry mouth, but a few years later it can turn into cavities, gum recession, or chronic jaw pain. So the big question is, what can we do to prevent this damage? Sometimes just a few simple changes in your nighttime routine can make a huge difference. Brushing with a fluoride toothpaste, flossing, using an alcohol-free mouthwash are the first and most important steps. And of course, don't forget to drink enough water during the day. For reflux, small lifestyle changes can have big impact. Avoid eating late, don't lie down immediately after eating, and slightly elevate your head while sleeping. These may seem simple, but they are vital for protecting enamel because once enamel is gone, it doesn't regenerate. In the end, your body is sending you a message at night. Dry mouth, jaw pain, or bad breath are all signals, not coincidences. Ignoring them only pushes the problem into the future. Nighttime oral care is a small investment for the healthier smile and less pain in years ahead, because your mouth isn't just a part of your body. Your mouth is the mirror of your body.